Um, I'm Laura, and I'm here to talk to you about sex today. I won't ask you if you have experiences relevant to this, to the topic of this talk. So I'm going to use low functioning and high functioning as shorthand sometimes to refer to people with and without comorbid intellectual disability. I know those aren't perfect terms, but I really want to highlight the importance of understanding similarities and differences between those populations. No? Okay. So today I'm going to talk to you a bit about what we know about autism and sexuality, about pediatricians' perceptions of their roles in providing sexual health care, how they talk about sex with families and individuals with autism, and their perceptions of barriers to providing this kind of care. And then I'll also talk a bit about what predicts parent engagement and parent-child sexuality communication. And I'll talk a lot about youth with autism, but I'm generally thinking about adolescents and young adults, although this kind of conversation can occur throughout the lifespan. So sex education is more than anatomy, behaviors, and risks like unwanted pregnancy and STDs. I think most of you would probably say that sex and romantic relationships have been a really important part of your adolescence and your adult lives. So sexuality includes how you feel about yourself, your values and attitudes, as well as your behaviors, and fulfills basic needs of belonging and acceptance. There isn't currently a lot of research on sex and autism, but I can say a few things with some confidence. So I'll go over those briefly, but know that there's more information out there. And I'll preface this by saying that there used to be an idea that people with autism weren't that interested in sex or relationships, but I don't think this is the case. So people with autism appear to mature physically at a typical rate, but may find it more difficult to glean all of the subtle sex and relationship information that's sort of bound up in their cultural environment without direct instruction. Thus, adolescents and adults usually have normal sexual and romantic feelings and engage in a variety of sexual behaviors typical of most people. However, there are some challenges too. People with autism sometimes find it more difficult to initiate and maintain romantic relationships similar to friendships. So on average, first relationships can occur in the late 20s or early 30s. Difficulty with social understanding can also lead to some inappropriate sexual behavior for people with and without intellectual disability. For example, masturbating in public spaces, following crushes home from work, touching people who are interested in being touched. And here we risk overly pathologizing the sexuality of people with autism, so I think it's important to note that neurotypical people engage in all of those behaviors too, and there's not great research on frequency between those two populations. But I think there is a sense that some people with autism are getting in trouble for behaviors that they may not understand to be wrong, and that could be prevented. We have a number of cases in our clinic where people got into legal trouble for things like public exposure, grabbing a child in the park that they wanted to talk to, or talking to teenagers on the internet. Research also suggests that people with autism may be more likely to identify as gay, bisexual, transgender, or asexual, so uninterested in sex, or not really attracted to other people. So you may want to think about how you would respond supportively to LGBT youth in your life or practice, and how you might help families who struggle with these identities. So knowledge is really critical for supporting healthy sex and relationship outcomes. You can't prevent STDs if you don't know how, and identifying abuse can be difficult for people who are used to following directions from authority figures, and who may have a harder time noticing red flags. Experts agree that sex ed should occur throughout life in a developmentally appropriate manner. For example, parents and schools can start teaching children about privacy and appropriate touch very early, and this conversation can include more direct instruction about consent and sexual assault as children age. We want this education to occur before negative outcomes happen, proactively rather than reactively. The time to teach about privacy and how to appropriately ask someone on a date are before someone gets in trouble or experiences multiple failed attempts at asking people out because they don't know how to do it effectively. Providing information about sex and relationships proactively is also anxiety reducing and helps adolescents transition more successfully into adulthood, where they're expected to share a level of knowledge and cultural understanding with their fellow students and employees. Additionally, we know that people with disabilities are more likely to be sexually abused or exploited, and one study found that adults with high-functioning autism who knew more about sex were less likely to report a history of sexual abuse or assault, suggesting that knowledge might be a protective factor. So there are many reasons to provide knowledge about sex and relationships proactively before you think that youth are engaging in sexual relationships. So this is hard. Developmentally appropriate sex ed is difficult for any parents, regardless of child disability, because people are uncomfortable talking about it, because people don't know when to bring things up, and because people worry that they might, sort of introduce this idea to children when they hadn't thought about it yet. But I think this is particularly difficult for parents whose child is developing at a different pace, or who has great skills in one area or many areas, but struggles with things like hygiene and social maturity. So parents want help, and early qualitative research suggested that they were not getting it. So for example, some parents were surprised when their child reached puberty on time and reported that healthcare providers had sort of responded reactively to sexual issues, but didn't talk about sex proactively before issues arose. Other parents noted that despite being involved with numerous different healthcare providers, therapists, school personnel, etc., they felt that they had no one to ask for guidance about sexual development and no one was talking to them about it. So parents often go to primary care providers for advice and to ask about problems first, and this means that pediatricians, nurses, and others in these settings can really be a valuable asset in minimizing some of those negative outcomes by ensuring that parents have accurate information about sexual health and are able to talk about it with their child. The American Academy of Pediatrics has issued guidelines on providing this kind of care to people with developmental disabilities, and these include things like modified gynecological exams that take into account sensory differences, genetic counseling for people that are interested in becoming parents, but they also really want pediatricians to regularly discuss physical, cognitive, and sociosexual development in a sort of ongoing manner. So really to bring this up every time you see a kid. The reason for this is because if this communication is open and regular, people are more likely to feel comfortable bringing up issues before they become major problems. That's not all, though. Pediatricians are also encouraged to discuss all of these topics, so promoting independence and self-care and privacy, educating parents about how cognitive abilities will affect sexual behavior and socialization, monitoring for signs of sexual abuse, advocating for developmentally appropriate sex ed, and providing resources to families so that they can address sexuality. They're also encouraged to spend time talking to youth without their parents present, but of course with their parents' knowledge, in order to convey that talking about sexual health with a doctor is appropriate and permissible, to allow some privacy for candid questions, and to model granting independence to parents. So this, some of you may be thinking, this is a lot to ask of pediatricians in the context of everything else that's going on with these kids, everything that we've heard about today. So we wanted to know how pediatricians were doing, and we teamed up with one of the authors of the AAP guidelines and did a national survey of pediatricians. We asked, what topics did you talk about with parents and youth, and what barriers they faced? And I want to note that almost half of these pediatricians had a specialization in neurodevelopmental disabilities, and they regularly provided care with autism, all of them. They were also mostly urban and suburban, so in a lot of ways this is a best case scenario. About 90% of our participants provided care to adolescents and 35% provided care to young adults, so an older age range than you might think about. So around 85% had training in autism beyond their medical residency, but as you can see, only about a third reported that this training had included or even mentioned sexuality. So most, of course, said that their training did not prepare them to provide sexual health care, and indeed only 7% said that it prepared them very well to fill this role. Yet despite this lack of training, over 90% of pediatricians agreed that providing care and information about both physical development and sexual behavior were an important part of their role. And this sort of differed from pediatricians who cater or to treat neurotypical populations. So I'll tell you a bit about what they discussed. First, they were asked to endorse topics that they bring up with every family, either routinely or at a certain age. So these included things like self-care and social skills, not related to sex, emotional maturity, puberty. You can see about 70% talked about puberty, with every family, cognitive deficits, and the heightened risk for abuse. About 54% discussed that. Pediatricians mostly discussed other topics as indicated, so more on the reactive side of the spectrum when things came up. These included the possibility of inappropriate sexual behavior, how cognitive functioning affects sex and relationships, assessing for signs of sexual abuse, and promoting sex education. Despite frequent interaction, like I mentioned, with adolescents and young adults, pediatricians infrequently talked about sex with patients without parents present. So as you can see, only about a quarter to a third had ever discussed sex and relationships with youth without their parents present. And additionally, 44% said that they did not provide families with facts about sex and autism. So clearly there were some barriers to providing sexual health care. These are percentages of pediatricians who endorse these barriers as being significant. So you can see that the biggest barrier, and you're probably not surprised, is that acute issues leave less time for sort of preventative care. But pediatricians also cited the lack of access to accurate information on sex and autism, a lack of training in this area, their perception of youth and parents being uncomfortable talking about sex, and the parents sort of perceiving the youth as childlike or asexual, so basically that these discussions are not relevant or appropriate for these kids. So some of these barriers require structural changes, particularly the time and what pediatricians are reimbursed for. But some can be remediated through the dissemination of facts about sex and autism, now that there's a little bit more information, resources for parents, and training on autism, sex, and relationships. I want to note that people who practiced longer didn't necessarily say that they faced fewer barriers or discussed more topics, but those who reported more experience with autism did. So parents accessing these pediatricians may be learning a bit more about sex and autism. And then we also wondered how those pediatricians who did have training in autism and sex conducted these kind of discussions. And we found that having training in sexual health care and autism didn't necessarily predict the number of topics pediatricians discussed, but training did predict pediatricians saying that they felt more comfortable talking to youth and parents about sex, and even though pediatricians sort of rarely endorse their own discomfort as a barrier to providing sexual health care, those who were more comfortable talking to parents and youth did endorse that they discussed a greater number of these topics. So training has a sort of indirect positive effect on practice. Given that parents had reported not having much support for providing sex ed, we also investigated parent-child sexuality communication. We surveyed about 200 parents all over the country of adolescents with autism, mostly mothers of sons, as you might expect, and asked them to endorse topics that they discussed. And note here that discuss could mean literally anything. Like I brought it up one time, I discussed it. So that's a limitation of these data. And I'll talk here about youth with and without intellectual disabilities. For context, the majority of parents who had a child with an intellectual disability said that their child was in the mild or borderline range, although there was significant heterogeneity in that population. And perhaps it's also important here to note that it's not at all uncommon for people with intellectual disabilities to have sex, fall in love, and get married, and have children. Yeah. So regardless of child intellectual disabilities, parents commonly endorse discussing basics like privacy, hygiene, puberty, prevention of sexual abuse, and topics that are not appropriate to discuss in public, things like that. But they were much less likely to discuss relationships and sexual health. So how to ask someone on a date, dating and marriage, how to know when you're in love, how to decide whether to have sex, how to choose a birth control method, how to use a condom. And this was especially true for children with intellectual disabilities. We also found this trend where parents of high-functioning youth discussed more topics as their child aged, but parents of low-functioning youth sort of plateaued at these basic topics, either because they didn't think that other topics were relevant for their child or because they weren't having a lot of luck in discussing these topics, and so they just sort of stopped while they were ahead, I guess. So parents of high-functioning youth also reported they discussed sex differently depending on their child's autism characteristics. So they discussed fewer topics with youth who had lower social motivation and those who had more difficulty decoding social cues. So given this, what if parents talked about fewer topics because they didn't think that they would be relevant for their children? Qualitative research has suggested that parents were fairly pessimistic about their child having the opportunity to engage in sex and relationships and might not prioritize it amongst the numerous issues that all parents face when their child was growing up. So we found that parents of high-functioning youth actually said that they were fairly confident that their child would do things like go on dates, have a healthy sexual relationship, and get married. Parents of low-functioning youth were a little bit more pessimistic, and there was more heterogeneity in this. So we analyzed whether autism traits and parents' romantic expectations for youth were related to the number of topics parents discussed. And we found that parents had lower romantic expectations for youth with more intense autism traits. Yet romantic expectations only predicted parents' discussion if their child had an intellectual disability. So for a big group of kids, parent romantic expectations really weren't driving the conversation. So we wondered what else was going on. And as you may be aware, parents usually have a lot of concerns about their children having sex. And so previous research has suggested that parents were worried about kids being taken advantage of, about unwanted pregnancy, about their child being devastated by repeated rejection, and about sex becoming sort of a special interest. So we wanted to know whether, for high-functioning youth, parents' concerns affected their discussion. So we were very interested. We found that the most common and intense parent concern was about whether a child would have a relationship one day. So parents were quite concerned that children would be lonely and might have trouble finding a partner. And it totally makes sense, on the other side, that parents want their kid to be happy. We also know that loneliness can be conceptualized as a chronic stressor and is related to depression for people with autism and is related to long-term increases in morbidity and mortality for neurotypical individuals. So in addition to relationships, parents had moderate concerns about negative sexual health outcomes like accidental pregnancy, yet less than half had talked about preventing these outcomes with their kid. So it seems like concerns really aren't necessarily translating into action, perhaps because parents aren't quite sure how to take action effectively. Oops. I have a missing slide, but I'll just tell you. So we actually found that the biggest predictors of topics covered were parent self-efficacy and preparedness, which someone has already mentioned. And I think this is great news. So basically we asked parents, how effectively do you think you can communicate with your child about sex, and how prepared do you feel to navigate or manage sexual relationships? And these were big predictors of how many topics parents discussed. And I think this is great because while we can give parents information about what to expect on average and a heads up about things like inappropriate sexual behavior, we really can't predict the trajectory of sex or relationships for any individual child. So we really can't tell each family what to expect or be concerned about. That's really, parents and youth themselves are sort of the experts on that. But we can improve outcomes by telling parents facts about sexuality and autism. Okay. So the biggest limitation to this literature so far is the focus on parents, doctors, and teachers. So research seems to be going in the direction, I know mine is, of asking people with autism about their own experiences. But this does make it difficult to include people who have trouble communicating via online surveys or interviews. So I'd love to talk about that with anyone. I also think it's really critical to reach out to populations who don't normally participate in research, so those who aren't white, wealthy, well-educated, to make sure that this research generalizes and is useful to communities. Let's see, so the most important thing I've learned from this is that we should all be talking about sex and relationships. Please talk to parents about their expectations and concerns, and do not assume a level of knowledge, because you never know what people have learned in their own lives. Sex and relationships aren't really things that we're all born experts at. We learn about sex and love from media and from other people, so just think about how involved your friends may have been in your early relationships. Like, should I text this guy? Should I call him? Is this person interested in me? So we really can't expect anyone to be a natural expert. And although these topics are sensitive and difficult to talk about, it's our ethical obligation to communicate to people with autism that their interests or disinterest in sex and love are normal, that people in their lives will answer their questions, and that their differences don't preclude them from having healthy relationships, because they don't. let's see. So also researchers, please include relationship-based measures in your quality of life studies and your long-term outcome studies. That'd be really helpful for me. So I just want to acknowledge my co-authors at the University of Utah and the Departments of Psychology and Pediatrics. And you all have these references in your slides. These are my favorite articles that I've really built on. And I'm always happy to talk to anyone about this. And I have some great, resources for you if you're interested. So thank you.